Discussion 1 for paramedics 2. Read the following articles and then answer the following question using the meaning framework. What do you think is the most important thing to remember and why? I think that the most important thing memorable for me in these readings was that no matter how long we have been in the profession as a paramedics, we had to always take care of our patients like they were the first time that we are taking one. By reading those articles, I found that some important things like how to follow protocols and standing orders could change the outcome of the patients and their future. I agree. With which item do you agree in the reading and why? I'm agreeing with this topic on the reading that in the tracheal intubation should be keep practicing in the performing the pre-hospital settings. If it is performing correctly, it can bring a good outcome on the patient and it will give you a bright future for them. But not because some people fail to do it, it will mean that all the paramedics will do the same thing. I highly agree with Dr. Mark Eckstein. He explains that if an 82 endotracheal intubation was performed successfully, there are some studies that report that a positive outcome on the end point on the patient. Not agreeing. With which item do you disagree and why? I'm disagreeing with those who says that endotracheal intubation and RSI shall not be practiced in the pre-hospital medicine and by the paramedics. One example is Dr. Wang, that he is saying that RSI shall be just restrictive practiced only by aeromedical settings. Interesting. What what information do you find interesting and why? I find interesting how they try to use focus on the bad outcomes that some endotracheal intubation had just bring to them, and they try to stop the performance of endotracheal intubation and RSI, but they are not giving like too much attention of what the outcome is when the placement of them is successfully and how positive outcomes they will bring. Confusing. Which item or information was confusing and why? I don't think I found anything confusing about those articles. Everything is I found everything like self-explanatory and specific, and what the point it's about it, and I found those like really interesting, and they really recall my attention because we are not the same, and every paramedic has the way to do things. Thank you.